Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Hey, Tom.
Hey, Parker.
Good to see you again.
Likewise. Parker was just talking about how you've got to get jazzed up for your podcasts, yeah. And I totally agree. Yeah, you got to be jazzed up for work and for mental health and for lots of different reasons. So
yeah,
if you need to take those extra breaths or two to get jazzed up, we always got to.
Yeah, podcasts are an interesting endeavor because you do have to. It doesn't matter if you're tired that day. You gotta get switched on. You gotta get ready. You gotta entertain the people. So happy to be here.
It's just on that tangent. That is the role for physicians, therapists, psychologists. It's your patients are coming to see you, and I think most patients know that you're a human as well and can have good days and bad days, but you're not there to share your problems with your patients. So you always need to get jazzed up if you're having a bad day before taking care of people.
Well said.
Which isn't too hard to do if you're in the right profession.
Yeah,
so.
Yeah, well said. I had an experience last week giving a speech that I wasn't prepared to give, not knowing I was going to be giving. And similarly, you just got to get jazzed up. You got to get the people going. So with that said, we can dive into this week's episode of the Sit and Stay podcast. This week, we wanted to focus a little differently rather than focusing on our broader topic of practice that we've been covering so far. Now we're going to be focusing a little bit more on the topic of billing, particularly setting a practice's chargemaster. So I think with that said, can you describe to me what a chargemaster is and why it's crucial in a healthcare practice?
Yeah, and I think it extends beyond healthcare practices as well, but it's interesting in this field how often people forget to think about, we've got to figure out how much we're going to charge people, and we've got to write that down, and we've got to be ready to let people know that, especially with new law passed recently where there needs to be full transparency in what patients will pay for services, especially if they're not covered by insurance, which is a good law that passed for consumers. And this sort of came out of the people getting bills for a $30,000 emergency helicopter ride situation. But we have a responsibility to know what we're going to charge people for what service we're going to deliver, and to present that to patients before they see us for services. That being said, often there's not a lot of thought that goes into creating your personal charge master, and it's something that's maybe done very quickly right before you're going to see your first patient. And I want to encourage people to think about your charge master at the very beginning as you're getting ready to set up your business and your budget, and to do your charge master in a logical fashion when the insurance and billing and healthcare industry is far from logical in a lot of things that it does. Doesn't mean you shouldn't be logical.
Right. So, I mean, it's a complex thing. It's really dictating how much all of the different services that you provide cost. So how does one sit down and figure out, essentially what are the key steps in figuring out what your charge master should be for each individual thing? And is there technology that can assist in maintaining that accuracy?
Yeah, great question. And, hopefully before you get to the step of the charge master, you've figured out kind of how much money you need to live on if your practice you're setting up is your sole, going to be your sole income. And then that can provide some guidance around your charge master. You should also do some work for the part of the country that you're in to see what other people are charging for services. But in general, for a mental health practice and for physicians and other practices, you're going to be setting up a charge master where you pick out what's called CPT codes, current procedural terminology codes. That is how you're going to bill for your services. And whether you're going to bill insurance companies or bill patients, each of these codes are going to need to have a dollar value assigned to it that is going to be the fee that you charge in your practice.
Okay. I mean, that kind of that kind of answers what my next question was, which was, how do the CPT codes, integrate with the charge master in the billing process, and why is CPT coding essential? I mean, you kind of just said it right there, because it's really going to determine how much something costs. It's, if you're using a specific CPT code, then it's supposed to cost that much. It's not, some special situation where I say the CPT code and it's more expensive for this person or that person. It's a way of really consolidating the prices. Am I getting that right?
Yeah, it's a way of, knowing what your schedule is going to look like, what your most common type of service you're going to provide is, then having a standard price for that service that you can, set as your charge. There are a lot of cautions and pitfalls to be thoughtful about when doing this. And we can jump into a few specific examples as well. I think in the world, to keep things simple to start out with, if you're a therapist or a psychologist, so we'll leave the physicians out of it for a second, but you tend to provide psychotherapy services, and these are broken into different chunks of time. And based on the time that you meet with your patients for psychotherapy, there's going to be a CPT code that corresponds to that. The most common CPT codes for non-physicians for therapy are 90834, which is 37 to 52 minutes of therapy. And then 90837, which is 53 plus minutes of therapy. And so if you're someone that likes to do 45-minute therapy sessions, you're going to, in general, be billing a 90834 most of the time. And so that's going to be an important code to get your charge master set up with. There are other codes that go with that. For example, an interactive complexity code. If you're using specialized equipment or doing a session in another language, or there's a lot of anxiety or tension with a parent you're maybe talking to about the child you're working with, that gets this extra 90785 code that oftentimes people don't bill, but that can bring in some extra revenue to your practice. I think some of the pitfalls come if you're someone who usually bills a 45-minute session and then the session goes 55 minutes.
I was just going to ask.
You are entitled to bill then a 90837. But if your patient has come to know that, hey, it's $150 for my 45-minute session, and then all of a sudden they get a bill for this other CPT code that maybe your practice charges $200 for, they're not going to feel great about
right.
that. And so in the different groups I've run over the years, we clearly put the responsibility on our providers at that, 50-minute mark to tell the patient, hey, I have time to keep going a little bit. It's going to result in this other billing code that has this other charge. You have to let me know if you want to continue or stop, which, is definitely complicated sometimes if you're in an intense therapy session, but it is one of the responsibilities we have as providers for our patients.
I've definitely had the experience of sitting in a therapy session and, you come close to the time. Maybe you can't see the time as a patient, so you don't really know that you're coming up, and it's just suddenly, all right, well, that's all for today. Oh, okay, we're done. Okay. And yeah, so I mean, some days it's very natural. Some days it's like, oh, okay. I mean, I was halfway through the story, but all right, I understand. I think in my case, I'm a little bit more familiar with that. But yeah, certainly. And I'm also just kind of an agreeable person. If you tell me the session's over, I'll be like, all right, cool, we're done. But yeah, certainly, I think that could be a pretty off-putting experience. So that is. Would you recommend that practice of, maybe interrupting to let them know, like, hey, we could go longer, and but it'll result in this code? Like, would you recommend that for everyone, or just is that kind of just like a general tip?
Yeah, that's a great question, and there's many different styles of practice, and every therapist, psychologist, psychiatrist will sort of know their nature. Do they tend to do well with keeping people posted on how much time is left, or do they also get lost and sometimes need help knowing where they're at in the session? And when you work with kids, right, kids don't necessarily tell time, and just like with your own kids, you want to, hey, we've got 15 minutes left for this, we've got 10 minutes, and I'm someone whose style tends to be working pretty hard to keep people aware of the time, but we've definitely have strategies where you can buy countdown clocks that are green, yellow, red, which can be a nice visual cue both for the therapist and the patient. Zoom sessions, one advantage of telehealth sessions is that you always have the clock on your computer screen, which makes it easier for both the therapist and patient to know how much time there is. But I do think it's very important to set clearly, what is the length of your standard session. And if you think about it from the time codes for the CPT code, the range is 37 to 52 minutes. Theoretically, you could tell patients, if you're billing insurance, our sessions are 37 minutes. Because if I see you 37 minutes or 52 minutes, I'm getting paid the same, and that's a 15-minute difference. And, it's in general confusing. It can be a hardship to accept insurance, so that can be a decision that's totally reasonable to make. You just have to be clear and upfront about that with your patients.
Right. Okay. Before we move on to the next question that I had on our specific list of what we wanted to cover, I did want to follow up on something that you said earlier about how providers could check what other people are charging in their area. What is I thought that kind of stood out to me. Like, how would one go about trying to figure something like that out?
Yeah, and it's probably not as complicated as it seems, but most clinicians in a given area certainly have colleagues or friends who are doing different types of practices. There are insurance transparency laws now where insurances have to post the reimbursement that they provide for different codes, albeit it's very complicated to dig out those numbers sometimes. But it's pretty easy to just do a search of providers in your geographic area. And not everyone posts their rates on their websites, but there are a decent number of people who do provide their rates right on their websites. And in addition, just by asking around through local support, organizational groups for regional groups of marriage and family therapists or psychologists or a general psychiatrist or child psychiatrists. You want to see what your peers and colleagues are charging and setting as their charge master.
Got it. Yeah. I mean, that's really good. That's really good information. So yeah, the next thing that I wanted to touch on is, can be historically, at least my experience with it, can be pretty complicated. are relative value units, also known as RVUs. So how would you describe what exactly a relative value unit is, and how does that relate to the CPT codes in the context of a chargemaster?
Yeah, so here's where we're going to get into some numbers and some math and again, right? Anything in the healthcare industry is in general going to start adding some complexity, but I do strongly believe that knowledge of relative value units and using data about relative value units and setting your charge master is the best business practice for a number of reasons. Most importantly, just from a logic perspective. But so let's jump back, Parker. Okay. So a relative value unit, or RVU, these are numbers that are assigned to different CPT codes. So any single medical or mental health procedure that you can have. So for knee surgery, for a physical therapy session, for acupuncture, there's going to be a CPT code for that. And then a relative value unit is a number that the federal government for Medicare, so Medicare is the health insurance that everyone qualifies for when you're 65 or older or younger if you get disabled. So the federal government assigns values called relative value units for every single CPT code that exists. And there are hundreds and thousands of these codes. What the government does is it breaks every procedure down into 3 different pieces that each have a RVU assignment. So the first one, and maybe the most important one, is called the work RVU. So that means that for a given CPT code, the federal government has said this is worth X number of RVUs of, quote, work to do this procedure. And we'll pull out some actual numbers in a little bit for common procedures. The other 2 pieces that go into the RVU calculation, one is for your practice expenses. So if you're practicing in Little Rock, Arkansas versus Seattle, Washington versus San Francisco, California, there's different costs associated with renting an office, furnishing your office, equipment you need to buy. And so that's called the practice expense RVU component. And then the final component to RVUs is a malpractice insurance cost, which again varies by specialty and for the services you provide. So those 3 pieces, the malpractice cost, practice location cost, and how much work the actual procedure you're doing is, that's what makes up the RVU for a given CPT code in the region you're at in the United States.
Wow. Okay. And that relative value unit, does that relate to income?
It does. So, and what I'm going to do, Parker, just to make things a little clearer, I'm going to pull up some 2023 numbers, and this is for Alameda County, California, in the Bay Area. And let's talk about the code 90834, which I mentioned a little bit earlier. So for the code 90834, the total RVU, so that's taking the different components that I mentioned and adding them together for Alameda County, California, you come up with this RVU value of 3.34 RVUs. So if you do a 45-minute therapy session with a patient in Alameda County, California, the federal government would say, hey, that's worth 3.34 RVUs. Okay, well, then we've got to convert the RVUs into dollars. So if you were billing Medicare, so if you were seeing someone who was 70 years old and they were using Medicare, you would be reimbursed $33.89 per RVU. So that 3389 times 3.34 RVUs
Okay.
is $113.32, which, Medicare in general pays reasonably, right? There's Medicare, which is the health insurance for everyone over 65. And then there's Medicaid, which has different names in each state. Medicaid tends to reimburse much less than Medicare. But the reason I recommend using the Medicare established RVUs is this brings logic to how you set your chargemaster. And in general, all commercial insurance companies look to what Medicare does with its RVUs and reimbursement policy, and then they tend to follow suit. So, for example, if Medicare decides to start covering a new procedure or there's a new CPT code, usually the commercial insurance companies will follow suit after this. There is logic to how Medicare set, it's still subjective on some level, like how do you decide the work of a therapy session versus knee surgery, but we won't get into intricacies there. But for the 45-minute session, which is 3.34 RVUs, then if you jump to the 53 plus therapy session, it jumps to 4.92 RVUs. So this is why, there is sort of a logical, okay, you're doing a longer session, you're getting 1.5 approximately extra RVUs. It makes sense. And so we want to, whether or not everything else in the healthcare industry makes sense, and certainly insurance companies and most practitioners don't set their chargemaster based on RVUs, but I think it gives you a leg up in explaining your charges both to your patients and if you're going to be brave and try to negotiate with insurance companies.
That 4.92 was for which code again?
That's for the 90837 2023 values for Alameda County.
So,
which, if
that's no small extra amount between the, what was it, 37 to 54 minutes? Is that what 90834 is?
Yeah, so 90834 is 37 to 52 minutes.
37 to 52.
Right, and then and then at 53 minutes, you go to the 90837.
Got it.
So if you're someone who likes to do 50-minute sessions, which, right, historically, it's an hour. When is an hour not an hour? Oh, when you're doing a therapy session, it's only 50 minutes. But yeah, so if 52 minutes, Medicare would pay you $113. For 53 minutes, you'd get $167. Goodness. So just from a business perspective, if you're someone who likes to see patients for 50 minutes, make it 53 minutes to maximize your revenue. Otherwise, it's hard. I tend to do 45-minute sessions. It gives you, I just like the feel for that a little bit better. If I have very complicated cases, then I might do a 60-minute session knowing we're going to bill for the next time period up.
So then in the patient's experience, say some people might be used to paying like a $30 copay every single time they go to see their provider. When they get billed at 90837, is it going to be any higher for that specific session?
It would not be higher. So that's a great thing about if you can get insurance contracts that pay reasonably for the different codes. For your patients, their copay is going to stay the same.
Got it.
They're not going to need to pay any more. That being said, Parker, a lot of people have insurance policies that have a co-insurance, not a copay, which is like 10% of the visit. So for those people, it would go up, although not tremendously. I think a lot of people now do have these high deductible plans, in which case it is a more significant dollar value that patients need to pay until they hit their deductible, and then they don't need to pay that anymore.
Got it. And everybody's copay might not be as low as $30. Not everybody gets to have such a low copay. Speaking just from my own experience, but yes, I mean, I've had a copay of like $120 before in the past, and yeah, it all comes down to the type of insurance plan that you have.
Correct. Yeah. Yeah. We see a range from, no copay to, like you said, could be $120 per visit. And so it's always important, because often when people are signing up for their health insurance, you're not reading the fine details about some of the copays, and so it's always important to try to verify those benefits as best as possible if you take insurance before people show up for that first visit.
Understandable. Okay. Well, yeah, this has been great. I feel like I've learned quite a bit. This I think now would be a good natural endpoint to go ahead and conclude the first episode, I should say, part 1 on this specific topic. Join us next week. We're going to go ahead and dive into this a little bit more. We still have a few more questions, but we'll let you wait to hear that then.
Awesome. Thanks, Parker.
Thanks, Tom.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.